What's up, and welcome to The Art of Being Well. If you're struggling with things like brain fog, fatigue, autoimmune problems, digestive problems, metabolic issues, there's a commonality between all of those issues, and it's inflammation. So our job in functional medicine is not only to measure the inflammation, of course, but to figure out what's driving that inflammation, both physiological issues like underlying gut problems, environmental toxins, nutrient deficiencies, and mental, emotional, spiritual facets like chronic stress, unresolved trauma. Anyways, there's a brand new 3-part docuseries that is completely free for you to learn more about inflammation. So go to drwillcole.com/IU. Again, that's drwillcole.com/IU for Inflammation Uncovered. It's a 3-part docuseries called Inflammation Uncovered for you to learn more about the fascinating world of inflammation, and more importantly, what to do about chronic inflammations. You can reclaim your health and live the life you were created for. And also at drwillcole.com, we have lots of free resources as well if you want to learn more about a wide range of topics that I've written about over the years. About every month, we have entire episodes devoted to your burning health questions in an Ask Me Anything episode. And today is the latest edition of the AMAs. To help me out every Ask Me Anything episode, we have 2 brilliant members on the clinical team here at the Telehealth Center, Andrea and Emily. What's up?
Hello.
Hi. I like when you call me brilliant.
I feel like we should always like high five.
Oh boy.
Oh boy. And I went along with it with no qualms.
Anyway, so you're going to get an insider's behind the scenes look of what our day job is consulting people around the world, getting labs and providing them functional medicine protocols and tools to optimize their health and how they feel. So submit your questions, everybody. We put everything on a Google Doc. Email your questions to hello@drwillcole.com. And you can ask anything: nutrition, wellness, trends, functional medicine, labs. We get a lot of lab questions, health science, things that you've read online or in the journals. Just submit them and we'll give you our hot take from a functional medicine perspective on these topics. So let's jump into it. What's the first question?
Sure. Yes, we love going through these questions too. So please submit your questions.
I want us to have hundreds upon hundreds of questions.
Well, we do right now.
We do.
Yeah, we do.
But I'm just saying I want more.
We do have. Sorry for everybody who's like, when are you going to answer my question? What episode will be in? We're getting through as many as we can.
Yes.
But we have lots of questions to get through.
Awesome. Well, let's get started. Okay. So the first question, this person says, Dr. Cole, I know you get a lot of SIBO cases and you've mentioned having success with them on the podcast. What does success mean for this? Does it mean that the SIBO is gone? What is the likeliness of it coming back?
So what I'm talking about there is success as far as the decrease of severity and frequency in those flare-ups. You all know this. So what is SIBO for people that don't know? It's this acronym that stands for small intestinal bacterial overgrowth. It is one of the leading causes of bloating, chronic constipation, IBS as a whole, IBS-C and IBS-D. So irritable bowel syndrome, a lot of those cases predominantly are driven by SIBO. We have to deal and heal the SIBO to heal the irritable bowel syndrome. Or if you don't, know you have IBS, just someone that has difficulty with their going to the bathroom, either chronic constipation or looser stools or vacillating between the two. It's one of the leading causes of acid reflux and GERD as well. There are studies to show that SIBO may have an autoimmune component. It's certainly associated with many autoimmune cases. Many Hashimoto's cases will have these sort of IBS type issues that SIBO is at least a piece of the puzzle. So it's a lot of people. So what the question was, what does success mean? Success means not having those symptoms anymore. That's what success means. Mm-hmm. Healing is nonlinear with all chronic issues, especially with gut health issues like SIBO and autoimmune problems as a whole. So I'm not to make it seem like it's a quick fix. It's not a quick fix for most people. Some people it is, right? Some people we get lucky and their body's amazing and resilient. Maybe they caught it earlier on or whatever. But most people healing from SIBO and other issues like it is a nonlinear journey, right? And what I typically would say for the average SIBO case, and we're talking about 15 plus years of experience in this space, I would say every 2 to 3 months, I want to see decrease of severity and frequency. So if somebody's a 10 out of 10, I want to see it moving in that significant movement in the right direction of decrease of, if it's 10 out of 10, maybe it's a 7 out of 10 or 6 out of 10. In every 2 to 3 month increments. And some months are going to be better than other months. Some months are going to be slower than other months. But typically that's enough of a window of time to us to see shifts in either the frequency or severity or both of those issues. And then when we can look back in chunks of time of like 7, 8, 9 months, that's a more of a bigger window of time of us be able to look back. And the person typically will say something like, I have way more great days and good days than I used to have.
Yeah.
And the bad days aren't as bad as they used to be. And about that 5 to 7 month range. And that means that they're doing a lot better. They're encouraged by the things that they're seeing, but they aren't, like, we're not 100% across the board for most cases. And we're talking about more resistant cases. We're used to beyond the basics. Like, most of our patients eat exponentially more healthier than the average person out there, but they're still not where they need to be. So I'm talking about beyond the basic cases. If you're talking about the average American, maybe they'll get better faster. And believe me, I would love more cases like that. But God has brought us typically the people that need a higher level of experience, I would say. Yeah. That it's just, who we tend to help a lot of the time.
Yeah.
So if they can get better, you can get better. Because I'm used to those type of cases mostly. But when you look back over a year to 2 years, that's typically the time frame that I would say, and let me know if you girls agree with me, that the person is at the upper echelons of where they are going. So maybe like 80% to 100% better most days. And that doesn't mean flare-ups can't happen. Of course they can. Right. But I need to decrease severity and frequency. I need to get them to be as resilient as their body's capable of being, which for most people, it's really a great place. And they have built resilience. So the things that used to cause flare-ups before, they can quote unquote get away with it, or they have more wiggle room than they used to have. That is where we see typically in that time frame, is that we know their wiggle room capacity. Some people have a significant amount of resilience and wiggle room after they've healed their gut, improved vagal tone, lowered inflammation levels, dealt with what's stressing the body out. And some people are more resilient than they used to be, but not where, they can't go completely get hog wild on things that don't love them back, because there's genetic components to this. There's depending on how long somebody's dealt with this. Yeah. Because we're talking about bacterial overgrowth, but we're also talking about migrating motor complex and that vagus nerve. Right. So we need to have a both and approach to healing from SIBO and other inflammatory problems. So dealing with environmental toxins that could be decreasing the MMC. We're dealing with things like mold and herbicides, pesticides, forever chemicals, microplastics, things that are stressing out the body, that's decreasing that migrating motor complex, allowing those bacteria, colony-forming units to grow into the small intestines. So it is a journey. But we want to figure out what are the tools that are the most effective to get them to that place. So I think that answered the question, right? What is the likeliness of coming back? I think, what we'll discover over that time period of months together is figuring out what are let's get you resilient, but then what's your wiggle room? So if somebody's sticking to the things that love them back, and their protocol is going to evolve as their health improves, but we're going to figure out what are the most effective tools to keep things resilient, then I don't see things coming back because they have that intuitive awareness on the things that love them back. And so without knowing the context of your case, that's typically our experience for people with SIBO and other digestive problems like it. What do you girls think?
I often find myself also using that word resiliency, right? If someone's going to ask me, what is that success look like? It is building that resiliency, because yes, we want to take care of the dysbiosis, but at the same time, why is the gut vulnerable in the first place? The microbiome, all of that vulnerable in the first place. And so I think it really is working on making a more resilient body, right, that can adapt. And right now we may start out with you trying to just manage to keep your head above water, but of course you're always going to want to manage your health, but can we manage it? Can we get you to a point where you're managing it because you've just found what works for you and not just to try to keep your head above water? And we should see the body head in that direction, and finding those things that love you back, that make you feel good. And like you said, Dr. Cole, we know that flares happen. And Andrea, I know that you can speak to this personally too. And so I think it really is, I think resiliency is the best term for it. Can your body better adapt to the stressors? Because we can't in life, right? And we can't remove all of these things, but if we're healing, we should be able to adapt better to it because we found the things that really work.
Yeah. And all of those are great points. And I know that this particular person didn't ask about this, but part of what makes our patients successful is looking at the other components beyond just SIBO. You mentioned a lot of them, Dr. Cole, but that's really important. It's like, is it just SIBO, or are there other co-infections and accompanying issues? Are you a giant stress ball, not just driving like different immune stressors? Like, there's so many different components of this. And so if someone is I'm assuming when they're asking what's the likelihood of this coming back, it's because they're experiencing those relapses. And it's like, well, did you address every part of it that you needed to address? Or did you just take an antibiotic and hope that you killed off the SIBO? And we know the gut's complicated. We know it can take upwards of 18 to 24 months just to truly heal your gut. And so it's a journey. And so I think that our approach to reflecting on where are you every quarter? Are we finding resiliency when you do experience life stressors? Are we exploring your environment and other cofactors that could be contributing to this? Are you finding what does and does not work for you on just a regular daily basis? So that it's not that the likelihood of it coming back is because the antibiotic failed you. Is there something else going on that we need to address?
Yeah, so just to touch on some of the areas that we would lean into would be antibiotics. They could be herbal antimicrobials. They could be pharmaceutical antibiotics. But typically, as Andrea kind of inferred, the chance of relapse with just antibiotics, either herbal or pharmaceuticals or both, it's pretty high for a lot of SIBO cases. Sometimes you can get lucky, and it's just the round of cat's claw, cemento, or oregano or a pharmaceutical, rifaximin, Xifaxan, something like that. It's one and done, and you're good. But a lot of people, it does have a chance of. So you have to have an entourage effect of the different factors here to improve that resilience over time. So hopefully we got that point across. But yeah, great question.
Yeah, love it. All right. So next question, Dr. Cole, is really simple, short. I would love to hear Dr. Will go through his full current supplement routine.
Wow. Full. Well, here's the secret. When somebody is in a good place of health, and this applies on a clinical level too, and I practice what I teach, you should predominantly get your nutrients from foods. Like, you cannot supplement your way out of a poor diet. They're called supplements for a reason. Right? They're supplementing key things that you need. So for the most part, I use my food as medicine, and I'm targeting things that, based on labs or my own health, things that I want to optimize, specific things. Hopefully everybody knows that. So clinically, if somebody's dealing with SIBO or an autoimmune problem or mold, whatever you're talking about, yes, their supplement list. Like, all our telehealth patients that are listening to this right now are like, wait, I'm taking more supplements than this. And
there's a little asterisk next to Dr. Cole's
what you need
protocol
at this point in your health journey. And that's going to shrink. So I want that supplement list to shrink as your health improves. And so the context around this matters. But I would say the essentials are what I take every day. And we released the Art of Being Well supplement line for this reason, because people would ask us, hey, I just listened to the podcast. I'm not a telehealth patient. What are the essentials? So that's why we have those supplement protocol stacks. It's called the Art of Being Well supplement line. It's at drwillcole.com. So the essentials for me are a methylated B vitamin. I have a double MTHFR C677T gene variant, which means my body is about half or more, 60%, I've seen studies, inhibited of methylating at the MTHFR pathway. So my body's not good at many other things, but recycling down homocysteine being one of them, which is an inflammatory marker that you can quantify on simple tests that we run for patients. So we want homocysteine, this inflammation marker, to be under 7. If mine's not, I know I need to dose it a bit higher. And stress, environmental factors, plus the food, like the amount of nutrients you're getting from foods, and plays a role. And gut health, right? How much of these nutrients are we absorbing? Yeah. So I'm keeping that in mind. But so it's called the methylator. It's a combination of methylfolate, methyl B12, TMG. These are supportive of methylation, which has to do with detoxing and neurotransmitter synthesis and gut health and lowered inflammation levels. So I take a methylated B vitamin complex. I take a vitamin D3, K2. Without a doubt. I have a double VDR gene variant too. So you can talk about bioindividuality with this. We look at these gene variants. Yeah. So I have a double MTHFR, I have a double VDR, which is the vitamin D receptor gene. So I need to dose my vitamin D typically a bit higher on top of that. It's not just genetics, it's gut health again, it's geographics. Where do you live in the world? Like I don't live in the sunniest place year round. So I have to be dosing that accordingly, that vitamin D, which is responsible for thousands of different pathways. What else do I do? I take typically an adaptogen blend. I don't take the adaptogen blend every day, but if I'm more stressed at work or stressful season in my life, I will take things like ashwagandha, holy basil, functional mushrooms like lion's mane. I love the brain adrenal balancer from The Art of Being Well Aligned for that, typically. And then I take a magnesium. I was
going to say, you can't forget your magnesium.
Yeah, don't forget that.
Even know that you take this every day.
So a combination of magnesium. I love magnesium. Threonate, it passes through the blood-brain barrier. Yep. The nervous system loves it. Most people are deficient in. When we run those magnesium RBC tests, most people are low. So I take a scoop of the magnesium. That's what it's called. Super creative. Thanks me. So
I like it.
There's that. But I like combinations of magnesiums, not just one kind. That to me is my essentials. Mm-hmm. But I will here and there take a binder sometimes, like activated charcoal, zeolite, something like that. I will occasionally take glutathione precursors like N-acetylcysteine. I'll occasionally take phosphatidylcholine here and there. But again, if I'm focusing on food as medicine and really focusing on nutrient density throughout the day and bringing in gut supportive things to support absorption and digestion of things, the list isn't that big. So there's something for everybody based on what your goals are therapeutically, but that for me is what I do. But I am focusing on food predominantly. But what do you guys think? I know they didn't ask you, but I'm sure they want to know too.
So a fun fact about the three of us is we all have the
MTHFR.
Oh, that's right. I forgot about that.
I make this joke regularly to patients that they're in good company whenever we find that gene. It's
all three of us have
all
the same.
three of it, and it's a double.
Yes, yeah. And do you have the VDR one too? Because I do have that one as well.
Do.
So woohoo, we should all get high five.
So if you ever want a job here, you have to have this. You have to have poor methylation.
Yeah.
But yes. So I also take the methylated B supports. That's an essential. K2, D3K2. Take that as well, and magnesium. Those are my essentials as well. My supplements have changed probably over the past year, just because being postpartum, I do a little bit more digestive support because I've had 3 kids now, so I've always had some digestive problems. So just helping replenish the gut microbiome, and so I'm on some enzymes, probiotics, and then especially once I just recently stopped breastfeeding, so now I'm just on some hormone balancing support as well. So, but those are not necessarily always essentials, because a lot of times probiotics I'm still getting through food, fermented rich foods, which I still do those kind of on and off as well with the probiotic, but just getting the extra support right now.
We have a hormone protocol. Again, we created these because if people aren't patients, we just get asked so many times, like if I'm not running labs and you're not clinically monitoring me, what are the basic things I need? So we have a female hormone, both cycling female and perimenopausal too.
Yeah, no, so it's been very helpful just to kind of get things back on track. But yeah, those are what I'm doing right now. Andrea, what about you?
LOL.
She's predominantly using food too.
I
Yes,
am
she
actually
is,
currently,
especially right now.
primarily 90% food. I practice what I preach, and you guys know that. If I know that a patient would need to do something or take a supplement protocol, there's not a patient listening that I haven't taken more or the same amount as you have. But currently I'm doing a carnivore diet. So a lot of my nutrients are coming from red meats, organ meats, fish. I'm doing a lot of fish and shellfish, but basics. I don't ever abandon my methylation support. So the methylated B vitamins, vitamin D, which I probably don't need to be taking that right now, but it's just part of my routine.
For context, I recommended that Andrea do this because she had been coming out a stressful time of her life. So kind of, I want to use this as almost a clinical connection to the first question. When someone's going through a stressful time in their life, they may need more of that, like the analogy that I use, like a proverbial cast. Sometimes you need a cast on for a dysregulated system. So we use it as a time to kind of calm things down. To foods that otherwise are completely nutrient dense and fine are stressing an already stressed out system. So what Andrea's doing now therapeutically, again, we implement the same protocols for each other when we need it, is for a time. It's not meant forever, and then we're going to work on reintroduction. You'd like it sooner rather than later. I'd like it a little bit later rather than sooner, but we'll have that conversation.
I am plugging along. So
you're doing great. She's doing fantastic, honestly.
She is.
And people are going to have questions now. I just hear the questions coming in of like what it looks like, what do you eat in a day? But
probably, absolutely. Check back next month.
Yeah.
So as far as like from a general supplement support, I am still having probiotics though, because I'm not really having probiotic rich foods right now. So it's like, I'm not having any of the fermented dairy. I'm not having any fermented vegetables right at this point in time. Goal would be future wise for me to bring that back in, but I'm using very specific spore based probiotics right now.
Are you doing digestive support? I can't remember.
I actually stopped that. So I'm not really having the things that I'm not having carbohydrates, which is normally what my body has more difficult time. I do fine with fats and protein. So right now it's literally methylated B support, vitamin D, magnesium. I refuse to give up my magnesium.
So we're both taking the same things.
Yeah.
I didn't know that, but
And then probiotics, which is I'm more specific than you are with that. And that's it. But that's very simplified from where I was.
So you guys basically were taking the same thing, other than Emily's hormone support, which has things like Vitex,
which is what I was taking previously.
Yeah. So and why do we take this? Because when we look at labs for a living, most people are deficient in those things.
Yes.
Yeah.
So.
I like that you brought up the binder too. I don't take that on a regular basis. I have had some mold issues in the past that I took it more regularly, but I don't take it as often anymore. But when I travel, I will bring it with me, just because you don't know what you're going to be staying in sometimes, or what could happen. And I know that I can struggle to detox, especially with methylation impairments, anything like that. So I will bring that with me. So that was a good one to bring
Travel supplements are a little bit different. I do even now travel with a colloidal silver nasal spray and binder.
Yeah, that's good.
So those are like, as again, I can stay in the nicest Airbnbs or nicest hotels, but you don't know what you're breathing or encountering. So,
and again, we have these methylation and HLA which we need to talk about, but just gene variants that some people are more sensitive to these than other people, which is probably in a way how we fell into this space for so long, because it started with our own health journey.
Yeah. All right, you ready for the next one? Okay, this is an interesting one.
Okay.
So this person asked, what are your thoughts on using borax for arthritis?
Yeah, so borax, I'm assuming they're asking about boric acid or boron, which is the mineral. Borax is a derivative of that. But boron, the trace mineral, there is studies with arthritis and boron intake. So boron is a trace mineral. It's in a lot of foods, back to nutrient density and focusing on foods. Things like avocados, raisins, peaches, apples, pears.
Are you just throwing these out because we just talked about how I'm not having those things?
Rubbing it in. Yeah, it's interesting because of that. Like boron is now, if someone's having more organ meats and they sort of mineral-rich, animal-based foods, boron's going to be these trace minerals are going to be in those too. But generally speaking, people aren't eating those. So vegetarians and people that eat like a whole foods plant-based diet actually tend to have better boron levels as far as compared to the person that's not eating so many plant foods. So boron plays an important role in reducing the enzymes that cause inflammation in the body. So there's several studies that I want to talk about here. There's a 2015 review of the studies that found that boron supplementation, 3 to 10 milligrams a day, was found to have lower inflammatory symptoms of osteoarthritis, or OA, reducing cases by up to as much as 60% decrease of OA, osteoarthritis symptoms. There was a 2018 review that found that RA, rheumatoid arthritis, an autoimmune condition, that people that had RA tended to, compared to control, like people that didn't have RA, had lower levels of boron. So it seems to be the mechanism of action is the way that it works on the bone, maybe as well, like how boron can actually impact the way that calcium is deposited, but it also seems to have an immunomodulating effect as far as lowering inflammation. But I am interested on the impact that boron could have on other essential minerals like calcium and vitamin D, and like could that have a synergistic effect of why people are seeing benefits when they're supplementing with a boron supplement, of how it works. But there are several studies out there, reviews of studies that have found that boron supplementation is associated with lower inflammation levels. I have to say, clinically, because we're focusing on food, I don't have patients tend to like supplement with boron, but they're getting adequate amounts of boron, more than these milligrams that people are supplementing with through their foods. And we have them, if we need to do it from a nutrient density standpoint, track in something like Chronometer or MyFitnessPal or something like that. You can actually see what are these micronutrients you're getting from your breakfast, lunch, and dinner and your snacks. Boron is typically significant in the adequate amount from food alone.
Right. So
I would say boron supplementation, you're going to probably notice a bigger needle moving tool if you're not focusing on nutrient density from your meals. So that's not to say if you do have a nutrient dense diet, you can't see a change, an improvement with boron supplementation. It's not on the top of my list. We talk about whittling down that supplement graveyard list. I don't want people to take just extraneous things that are good in theory, but just supplementing for the sake of it. So I'm open to it. There's definitely studies to show it to be beneficial, but it's not high on my list. Boric acid, I've had good success with boric acid suppositories for people that have vaginal fungal issues or prone to UTIs and vaginosis. I have more clinical use of a boric acid suppository, a vaginal suppository for women's health, for vaginal health.
Yeah. And I know I agree with you wholeheartedly on the food and getting the nutrient density there too. Are there any supplements that you feel like would be better needle movers?
Yeah. Well, the bigger question is what's causing the inflammation, kind of how I started this whole episode out with, really figuring out what's causing the dysregulation of inflammation. So looking at gut health, looking at chronic infections, looking at chronic stress, unresolved trauma, these physical and mental, emotional, spiritual factors. So health history, context, labs would be helpful to figure out what is causing those flare-ups for you, and that differs from person to person. I love curcuminoids. Like we do different formulas for patients when we know their case and their labs, and we can dose it a bit higher. But if you're looking for a DIY, you don't have a functional medicine doctor, there's a formula that we have in the Art of Being Well line called Relief, which has the rhizome. It's standardized curcumin with the rhizome, so that the really good evidence-backed compounds that have been shown to the curcuminoids to lower inflammation, and boswellia. And it's standardized for the boswellic acid, which boswellia is frankincense, but it's used as an anti-inflammatory too. But like these standardized antioxidant compounds in both of these for plant medicines are in the relief formula in the Art of Being Well line. But
Yeah.
other things that I like, I think those are some of my top ones.
Yeah.
What I love saffron too. I think saffron's a good anti-inflammatory with some neuroprotective benefits too. What do you guys think?
Yeah.
We use CBD on occasion.
Oh yeah, CBD is a good example. Yeah.
Yeah, and a lot of times we can couple that with other co-nutrients.
Buswellia
Yeah,
and
the
turmeric.
buswellia and
Yeah.
turmeric and
Yeah.
black pepper if it's appropriate
Yeah.
for the absorption. We can also do testing to even find out if this is necessary. So there are different hair tests that look at things like boron and that we've run in the past. It's like one of those random things that come back and you're like, oh,
Yeah.
it's within range a lot of the times. You don't often talk
Yeah.
about it because
Yeah.
most of the time our patients are.
And if you're eating those foods, again, you're getting
Exactly.
And it's a
Right.
word of note, like caution here, like dosing high in these minerals, whether it's boron or another trace mineral, you can have toxic levels of these.
Yes.
These are
Right.
minerals that you don't want to have in excess amounts.
Yeah, this is why care is so helpful, because not only are we going to find what is right for someone's case, is we're actually going to find the right dosing. We're going to, you mentioned all these other areas too. Supplements is just one area. And if we are going to get to the root, we need to really take this bird's eye view approach and look at the body as a whole, your lifestyle as a whole, because all of those things are going to impact how you feel. I mean, even looking at chronic stress on the body, right? The physiological stress, the outside stress, those things are all going to impact arthritis and anything that you're dealing with too. So I think it's really important. The only other one that came to mind is peptides, which I know
Oh, yeah. Great point.
is
Going
something that we've
over
been
some ones that we like.
that we've been diving into a little bit more. I was just thinking of like the BPC 157.
Yeah.
So that's something that we've tended to
Yeah,
utilize.
great success with it.
Yeah.
Yeah, good point. Good point. Yeah, and you can use peptides transdermally or oral, and we see great success about the same
Yep.
Yeah.
I agree.
between injection and or oral. So,
Yeah, absolutely.
And you can get extended release or immediate release, rapid release for the BPC 157, which your body is making these. A lot of these peptides are just synthesized compounds that your body's endogenously making, but you can therapeutically increase that with taking exogenous peptides. Yeah, I love BPC 157. It's been a great tool for me over the years, and I love it for telehealth patients that have not just musculoskeletal inflammation, but gut inflammation.
Yeah.
Yes.
It's good.
And neuroinflammation too.
And I have to give an honorable mention to collagen because anytime we're talking about any joint
Yeah.
health, like I think arthritis, like things like that, collagen.
Yeah, that's good.
Which we also have. So again,
Holy man, yeah, that's another. This is gonna open a Pandora's box of like, oh, you can take that. You don't need all these things, but like, what are the needle movers for you? Is the experimentation or clinical experience are going to be some things. Every case is different, but MSM and phytoceramides,
it's good.
Holy Mane and Holy Radiance, those are supplements that I formulated with Agent Natur. That we have at drwillcole.com too. That the MSM is a great joint inflammation. It's a sulfur compound, which again, you can get these from foods if you're eating sulfur-rich foods.
Right. Yes.
But therapeutically, a supplementation can be helpful. And same with collagen. You can get it from foods if you're eating nose to tail and getting good collagenous broths in your diet. You don't have to supplement with all this stuff, but you can, and they can be a needle mover for you even when you are eating super intentional.
Yeah.
absolutely.
Next
All right.
question.
This is a long one, so bear with me. So the question is, my question pertains to ADHD medications, namely Adderall. I was diagnosed with ADHD as a child. I'm 30 now and began medication in high school. So we're looking at 20 years at diagnosis and medication. I've been on it ever since. I'm very into health and wellness and do my best to live as, quote, she put it in quotes, clean as a lifestyle as possible. With that said, taking stimulants every day really does not align with my beliefs, and I feel that they are no longer serving me. I've tried going off the medication several times in the past and have gotten severely depressed, something I've never experienced before. I'm a pretty optimistic person in general, but this felt very chemical, is the way that she described it. I've attributed this to the Adderall and always went back on it to avoid feeling that way. My question is there something I can do to come off the medication without depression that seems to always follow?
Yeah, so she said stimulants, she doesn't feel right taking stimulants long term.
Yeah, so she's basically, I think, and I keep saying she, I don't actually know. I think we just have so many female patients but she doesn't actually say if it's a man or a woman. Essentially looks like 15 years on medication. And at the age of 30 is realizing and saying this doesn't align. She's not demonizing it or saying anything's bad. She's just saying, I don't know if this aligns with what I want to be doing and caring for my body.
And then she has these withdrawal symptoms.
Which probably signals to me, it would signal to me like, what have I now become dependent on?
Yeah.
What's shifting in my body that I'm now this medication, anytime I'm stopping it, shifts my actual outlook on life. That would be.
Yeah. Well, look, I mean, Adderall is a Schedule II medication. It is in the same schedule as cocaine, as heroin, and meth. It is an amphetamine, just like methamphetamine, meth. It's not the same as meth, but it's like a chemical cousin of meth. It's basically legal meth, prescribed meth in many ways. And obviously one is used very much abused and other ones is prescribed. You're taking it as prescribed. You're not abusing it, I'm assuming. But it's still, that's the level of class of medication. And you can understand why coming off of it isn't always easy for many people, depending on the dose and how long they've been on it.
Yeah, I mean, this person was really hormonally just forming in their teens, and then the influence that can have in so many areas.
Yeah. So my heart goes out to you, and we can work with your local prescribing doctor to help you come off of that. You have to work with I think a psychiatrist in coming down, in tapering down, in addition to functional medicine would be my advice. So it's going to be a both and approach with the psychiatrist that's literate in tapering paired with a functional medicine approach. And we get on conference calls with the psychiatrist when we need to be on the same page, because we want to improve function as they're decreasing the dependency on it. So when you have rising function paired with a slow tapering down, we can have great success with it. So Adderall comes in for about 5 milligrams to 40 milligrams, and depending on the dose that you're on, and there's an extended release and an immediate release as well. The immediate release comes in tablets. I mean, we have patients that even cut the tablets in half, like when they need to. You can't do that with a capsule, but you can do that with tablets. And it's very low and slow. I mean, it could take months and longer for some people, and titrating that down. Not everybody, but if you're having these withdrawal symptoms, and this applies not to just Adderall, but other psychotropic medications, other
even antidepressants,
exactly,
like
SSRIs and benzos like Xanax. Like, it's really going to take time for anything that's impacting your nervous system like this and modulating it in that way. So this medication increases dopamine, increases neuroepinephrine. So our approach, in addition to the slow, like if you're going from 10 to 5, we're talking over weeks and months, you need rising function and resilience at the same time. And especially if your body's becoming dependent on this Schedule II medication like this. So some ideas would be, labs would help to know, well, what's impacting dopamine, what's causing dysregulation of the nervous system and the brain, so we can deal with it. So maybe there's unhealthy things going on in the gut. Maybe there are nutrient deficiencies. I know of studies when you're looking at vitamin D and iron and magnesium. These are minerals that your body needs to make dopamine. So sometimes there's nutrient deficiencies that will completely alleviate and allow that tapering of the medication. It'll happen a lot more unimpededly without any negative side effects, because your body has the raw materials to make dopamine, which you need for focus and mood and all of that stuff. You can also focus on dopamine, like the precursors to dopamine, like tyrosine. Tyrosine, if you're getting a grass-fed beef, wild-caught fish, egg white has tyrosine. Anything that's going to be protein-rich with these amino acids, tyrosine is a precursor to dopamine. I love, there's a formula in The Art of Being Well line called Chill that has GABAergic and dopaminergic precursors light magnesium, but it also has things like L-theanine, which is a precursor to dopamine as well, and has inositol, which can help with modulating dopamine. So I think that those are some things that we would consider here, is looking at these minerals, looking at some of these compounds. There's an adaptogen called mucuna pruriens that is kind of a bean type of adaptogen, but it has a compound called L-dopa, which is a building block for a dopamine. So those are some things that come to mind. Maybe some adaptogenic, maybe some mineral, maybe some dopaminergic and GABAergic properties that are supportive of GABA and dopamine in that way. And then food is first, right? If you're really focusing on nutrient density, that paired with a very methodical tapering down of Adderall, you can have great success over time.
Yeah, that's good. Yeah, I think the lab part is important there too, just because, what could really be impacting the brain here? Is there inflammation, stemming from the gut that because of that direct connection with the brain could be impacting how the brain can function? There's a lot of biotoxins, whether that's chemicals, mold, pesticides, herbicides that could absolutely impact neurotransmitter production. And so I think that these are all different areas that are important to look at if we want to figure out how to support healing so the body really can function on its own. I think those are great recommendations for us to support coming off medication, but ultimately too, if we want to see true healing, let's see what could be impacting it in the first place.
Yeah, absolutely. I agree with that, Emily. I mean, how many times, first off, I want to speak hope into this person that just because you've been on it for 15 years doesn't mean it's going to take, I'm saying 15, but roughly 15 years, doesn't mean it's going to take you 15 years to get off of it.
Yeah,
but your body is vastly different than it was as a teenager. Your exposures to other things, the stress that our lives can put us through, what have you eaten, how do you sleep, there's so many components of it. But you mentioned the testing, and I do think that that's important. We even look at an organic acids test, OATS for short,
it's good.
and this looks at HVA and VMA pathways, which is dopamine, norepinephrine, and epinephrine. So norepinephrine and epinephrine. So these are all things that we do look at on a regular basis. And it's almost like a light bulb aha moment for patients where they're like, oh, that makes so much sense. So it's I'm not crazy. Like there is something actually going on. And we're like, yeah, and there's things that we can do to help it. Even Dr. Cole, you mentioned saffron earlier when we were talking about this.
Saffron's another good tool.
This is another fantastic tool that we can help with that stabilizing component of giving your body the support it needs while you're healing and while you're weaning. So there is a way to do it. There's a safe way to do it. There's an effective way to do it. And not only that, we can optimize other components of your health that you might not even realize that we need to.
Yeah. I've seen some interesting clinical trials specifically for ADHD with pine bark extract, with the compound, they're proanthocyanins, so they're polyphenols basically, which I've seen other studies do something as simple as blueberries, like something that's rich in polyphenols can be supportive of cellular inflammation that is associated with ADHD. And so back to nutrient density, but I would say polyphenol rich foods is something to specifically call out from a food as medicine standpoint. Pine bark extract, you wouldn't be grabbing some pine bark and chewing on that, but hopefully not.
I'd try it.
Yeah. So yeah, you would get that in a supplement form, but like blueberries, extra virgin olive oil, these sort of pigment rich fruits can be really helpful. The flavonoid rich compounds can be helpful here.
Sounds like an interesting smoothie.
Yeah. Yeah.
I've probably had worse, so it's fine.
You and me both.
All right.
Smoothie. Sorry.
Yeah.
All right.
Carnival woes.
Yeah. Andrea's salivating
You could
over
do
here.
a smoothie.
A meat smoothie.
Hey.
We're not even going to
I'm
get
sure
into
Paul
that.
Saladino does a meat smoothie.
No,
here and
he
there.
actually.
Hey, if you challenge her, submit that as your question. Andrea will do it. She doesn't back down to a good challenge.
No, I don't.
All right. Last question here.
Also equally long.
Yes, very much so. All right. So this person says, my liver enzymes are quite high, potentially non-alcoholic fatty liver disease. The test was done in the UK, so unsure of the unit, but the acceptable range was listed as 3 to 35 and mine was 70. I'm wondering what I can do as far as diet, lifestyle, and supplements to help get my liver healthy. Would fasting or detox of some kind help? What are some signs that my liver is improving, and how long should I expect it to get back to a normal level? And when would be a good time to test again? There's a lot of questions in here. So below for basic health information, unsure how I even got to this point with my diet. I'm diving in with my therapist about some anger and resentment, and also have done research online for foods and such. And most of the recommendations are foods that I love, already eat a lot of, and have been craving extra hard lately. Could a high liver enzymes be the cause of my nausea, extreme fatigue, extra foggy brain, sudden weight gain, pouchy belly, pain below my ribs, or are those a Hashimoto's flare up, the stress of this year, or something else?
Okay, so this is a beautiful question. Thank you for the context, because this is the type of things that we would talk about in a one-on-one consultation, and like have extrapolated deep dive conversations about the context and nuance of this, and so much more than that. So I would encourage anybody going through these type of issues to consider a one-on-one consult. But, in lieu of that, know that there's some caveats here. I don't know your full health history, and I'm not giving advice in the podcast. These are just suggestions to learn more about. I should be clear on that. We're giving advice, but they're advice for you to inform yourself more on. It's not prescriptive this is not a replacement for seeing a doctor.
Yeah.
This is just a podcast for those who need reminding of that. But we want you to be empowered and encouraged and informed, and make informed decisions for your health. The answer, I guess one layer of that question, yes, fatty liver disease, non-alcoholic fatty liver disease can be implicated in things like brain fog and fatigue and the sudden weight gain, certainly. So what's happening here from a mechanism of action? The body has these brilliant compensatory mechanisms. It's trying to, typically the leading cause of non-alcoholic fatty liver disease is insulin resistance. I mean, we're talking about upwards of 93% of the world. This is specifically a United States study that I'm citing. This person's in the UK. UK has similar statistics, slightly better than the US, but not much. And modernity has created this sort of discord with human physiology. So the body has insulin resistance, the glucose is in excess, the blood sugar is in excess. So the body is saying, oh, I need to get blood sugar down because it's toxic. Where am I going to store it? So it stores it as circulating fats or triglycerides. So you're going to see triglycerides above 100, typically with someone with NAFLD. You're going to see, let me repeat that again, triglycerides above 100, if I didn't say it correctly. You're going to see the liver enzymes, AST and ALT and GGT spiked. You're going to see fat around the liver. If you did an ultrasound, that's going to be part of that fatty liver diagnosis from a conventional medicine standpoint. You're going to see blood sugar, fasting glucose above 90. You're going to see A1C above 5.6, maybe, depending on where you're at on that insulin resistance spectrum and how soon or how long this has been going on. So the body's saying, I need to get blood sugar down. It's storing it as fat around the liver, circulating fats or triglycerides, or fat around the midsection, or like she said, sudden weight gain. Yeah. This is sort of the hallmark of non-alcoholic fatty liver disease. It's driven by insulin resistance. So of course it can cause you symptoms. It doubles the risk of these things like fatigue and brain fog and weight gain. And they said pouchy belly and pain below the ribs. Classic hallmark set of signs and symptoms. Mm-hmm. The beautiful part of this is that it's reversible and overcomable and healable. Some people, it's more resistant than others because of many factors. But a lot of the things that we talked about earlier in the earlier part of this episode would still be applicable to you, just specific to insulin resistance. We'd want to look at your metabolic health and understand what's going on. But environmental toxins, stress, foods that don't love you back, gut health, all still play a role in cardiometabolic issues like fatty liver disease. The protocol is going to look a bit different. I mean, there's going to be compounds that we would implement into your protocol that would not be relevant to somebody with SIBO, per se, right? If they don't have liver issues. But things like food is primary here, like optimizing protein at the bare minimum, 100 grams of protein from high quality, complete protein sources throughout the day it's going to be more than that, but I would say scraping the minimum 100 grams a day, focusing on healthy fats like omega fatty acids have been shown to decrease non-alcoholic fatty liver disease. Not fearing fruits, but someone that is insulin resistant may want to do a moderate to lower carb approach for a time.
Right.
And then as they improve insulin signaling sensitivity, you can increase those carbs. And whole food, fiber-rich fruits do not behave the same way that like a refined, processed, sugar-laden without fiber. So I don't want people to fear fruits, but you have to meet your metabolism where it's at. And if it's causing lots of glucose spikes and it's not coming back down postprandially, like after your meals, then it's not the fruit's fault. We have to meet your metabolism where it's at. So we're talking about months maybe of being more moderate with those, and then you can increase those carbs after that from whole foods. Some supplements like liver support is going to be helpful here with things like N-acetylcysteine. B vitamins can be helpful here. Milk thistle, silymarin is the antioxidant compound in milk thistle, can be really helpful here. There's a formula called Protect in the Art of Being Well line that is supportive of liver health. But again, food is going to be primary here. She mentioned intermittent fasting. Intermittent fasting is a great tool for someone that has metabolic syndrome.
Yeah.
So really experimenting, starting off low and slow if you've never intermittent fasted, but really it's like a proverbial yoga class for your metabolism. So you're going to probably suck at fasting if you've never done it and your metabolism is very inflexible. But really, check out my book, Intuitive Fasting, for that. But there's like a protocol in there that kind of does expanding cyclical fasting, where we're doing some deep fasts, but then some looser fasts to kind of get that metabolism more flexible. A C15, I had Dr. Stephanie Van Watson on the podcast. She discovered this. Speaking of, we bring up dolphins probably every episode, but
I feel like there's something going on here.
Yeah, so it's Dr. Stephanie worked for the government, and she studied Navy dolphins. That the Navy has a whole fleet of dolphins, if you will.
What?
Yes, you have to go back and listen to the episode. It's fascinating.
We're going to talk about this after.
Yeah. So it's fascinating. Anyway, it was the first essential fatty acid discovered in over 90 years. So C15, we can measure this on telehealth patient labs. You can see C15 levels. Most people are deficient in C15, and you can replenish it with a C15 supplement. You can get C15 from foods like dairy fats, like grass-fed cheeses, full fat, like raw dairy. You can get C15 from foods. But if maybe you don't tolerate dairy or eggs, cheeses, then maybe you would want to supplement with it. Sure. With a C15 supplement. It's called Fatty 15. So that's food and a supplement suggestion there too. But the liver needs C15 without a doubt. What do you guys think?
Yeah, I mean, I love what you talked about with figuring out the insulin resistance. And I think just understanding how big of a part the liver does play in all of this, right? You know, I think that we understand that it's a detoxer, right? It's helping detox the things that we're exposed to on a daily basis, but it's in constant communication with our entire digestive system. It is helping regulate blood sugar. It is helping do all of these things. And if we want it to function well, we need to make sure that we're taking the stress off of it. And I know that this person is really just looking for tools and ways to really help this. And even mentioning like a cleanse or whatnot. This is where I think sometimes we have to have that conversation, because while doing a cleanse, if you're doing it appropriately, is not a bad thing. Is it really going to fix the bigger issue? Is it really going to help the liver thrive, or is it just going to maybe fix it for a time, or maybe, lower the number, which it's not just about lowering the number. If we fix the issue, the numbers are going to resolve on their own. I think that that's where my thought process is going to lean more towards, is not just trying to lower the number, but how can I take the stress off so that way it can naturally function and optimize on its own. So,
and I just go to the, overall, are there other components that we need to think about? She mentioned Hashimoto's, so she has autoimmune components of her case. Are there hormone components that we need to consider? There's just so much that I think that what we've talked about is a great baseline approach. I think that you can use intermittent fasting. You can use, lowering your glycemic index type foods that you're having, making sure that you're not leaning too heavily into things that are going to exacerbate that insulin resistance. I would suggest this person needs to be working with someone. That's my first inclination, is that if your liver markers are double, you can do all these awesome things and you may make some headway, and get your head above water and start to figure out what's going on. But I'd want to talk with this person. I want to look at labs. I want to figure out if there's something else going on here.
Yeah, environmental toxins are an interesting thing with metabolic issues.
Yeah.
You look at forever chemicals, PFAS, microplastics, herbicides. There's a lot of research showing these cardiometabolic issues they exponentially increase the risk of metabolic issues.
Yes.
Yeah.
So like those things we mentioned are going to be supportive of all of that, but you may need sort of a deeper approach to clear this
Like,
stuff
why
out.
did it climb? Like, what caused your insulin resistance?
Right.
You're saying that she mentioned all throughout there, like, I'm eating all these foods, I'm doing all these things that everything's telling me to do. What's going on?
Yeah.
Right.
She mentioned the anger and resentment, which is another issue.
Yeah.
Yeah.
And this is why I think it's so important what you're saying of getting to that root, because sometimes I feel like, again, we can do the best job managing it to keep our head above water, but it almost starts to feel like you're on a hamster wheel that you can't get off of. And even though you're doing great things, is it helping you manage it, or is it truly creating that resiliency that we were talking about?
Yeah.
And that's where I think that, yes, you can do all of the right things, but if you don't figure out what's actually causing it, if you're not working with someone to get to those root issues, I think that you're sometimes going to feel like, hey, I can never stop doing what I'm doing.
Right, exactly. It's like, it's keeping it at bay, but not
Right.
like really emptying that bucket significantly to
Right.
gain that resilience that we're talking about here.
Yeah.
Yeah.
Yeah. Yeah. Is that the last question?
That was the last question.
Unless you want to make any dolphin sounds or ask a dolphin
no.
question.
Let's not do that, please.
Flipper. So thank you all. If you want to learn more about our clinical work, tons of free resources. We have a search engine option at drwillcole.com. You can type in anything you want, and they're all articles with PubMed citations for you to like geek out on all the things that we love to implement in people's lives. We'll see you next time.